welcome to Meddkit's Provider Spotlight, where every week we are interviewing the most amazing private practices from all over the United States. Every week we have a really amazing special guest who I'll introduce you shortly to. But every week we come here with new perspectives, new ideas, and really important as you know, healthcare is evolving, to seeing what's out there and seeing what people are doing in their communities and helping their population out. So today I have a really awesome special guest. I want to introduce you guys to Dr. Ali Navidi, CEO and co-founder of GI Psychology. So welcome, Dr. Ali. Super nice to see you.
Thank you, Rachel. I'm happy to be here and happy to have this nice conversation with you.
Same here. I know we have a lot to get to, and you guys are doing something really interesting and super innovative in your space. So I kind of would love to know from you, what is your background, your story? Like what inspired you to open up this amazing practice?
So, should I say anything about the practice first? Maybe a little?
Yeah,
Yeah.
absolutely.
Okay, so the practice is a very specific one. It's a behavioral health practice that focuses on treating patients with GI problems,
Hmm.
which is actually probably the only one of its kind that's being done at a national level.
Yeah.
And then so I answer your question, let me jump back from the
Yeah.
description of the
Let's peel
practice.
it back.
Yeah, yeah. And I'll say like what got me here. So I'm a clinical psychologist and I've been I've been treating patients in a private practice, just me, for 14 years in the DC metro area.
Hmm.
Big crowded area, lots of therapists, lots of psychologists.
Definitely.
Um, but I kind of got frustrated because there really wasn't anyone for me to refer to if I was full. And there's plenty of therapists in this area, and just it's so rare that people have this specialty to work with GI patients. Um, so about 5 years ago, myself and another psychologist, we started GI Psychology, and the mission was we wanted to improve access to care for patients with these GI problems. And again, because there was so few uh, providers out there, and because we needed to get the word out also, because patients didn't know that we had these really powerful, empirically based treatments. They just live their whole life and not know it.
Yep. In terms of the population that you're serving, I feel like a lot of people feel lost. And so that's why I really would like to dive in because what you are doing is so niche. But, maybe you could tell us about what people are currently experiencing, before they're coming to see you. What kind of GI issues are they dealing with? As we know, there's a large spectrum out there. And so
Yeah.
it'd be great to hear a little bit more about, the population, what are some of your common ailments that you find people are struggling with, but also maybe not the so common things that you might see. And you're like, wow, this is rare. We don't come across this a lot, but we do help these people. And it's important that they know there's a path.
Yeah. Um, so the disorders we typically treat are in two major categories. One is called disorders of gut-brain interaction.
Okay.
And these are disorders that used to be called functional GI disorders. And you would probably know them because one of those disorders is irritable bowel syndrome.
Hmm.
This is kind of a well-known, very common disorder. 1 in 10 Americans have IBS.
Hmm.
But that's just one of the disorders that we treat in that category of disorders of gut-brain interaction, right? There's about 20 other disorders.
Sure.
One called like functional dyspepsia, and that's more the upper GI. types of GERD where it's like reflux, there's
Totally.
vomiting, nausea, all the fun stuff people love
Oh,
to talk about all day long. We just talk about, we kind of joke because we're like, we're very happy to talk to people about poop. We're, like that's kind of our thing.
I'm sure you have a lot of good poop jokes up your sleeve.
Actually, you're kind of embarrassing me because that is a great idea, and I don't have any poop jokes.
Oh, well, you know what? Save it for a social post for later, right?
Yes, yes. Maybe after we're done taping, you tell me your best poop joke, and I can
Yeah.
start.
Yeah. No, I mean, we gotta, this is real life, right? We gotta talk about it.
Yeah,
This is really what people are experiencing, right? These are real fears, real happenings, and sometimes it's just the ugly but truth, but it's the reality of what we're going through. And sometimes we're afraid of reaching out and feeling we're alone, and you feel terrible, right? These people feel
yeah,
terrible. Nothing, everyone I feel like at some stage has gotten some type of food poisoning or some type of stomach
right.
upset, and you know how debilitating that is. But think about it now on a regular occurring basis is
Yeah,
what's happening that's it affects you deeply, right?
it does. And I rarely talk to someone who either turns out they've got one of these disorders or someone they love has one of these
Yeah.
disorders. And usually, almost immediately, they're like, oh, yeah, my aunt,
Yeah.
Mindy, she won't go out to dinner with us because she's scared, and if there isn't like a bathroom around, she's not going to come. Like either people have it or they know somebody who has it. It's that common.
Yeah, absolutely. It's like if, you can name four people, right off the top of your head and at any given
Yeah.
moment, and you know what they're dealing with. So I would love to hear a little bit about, how your approach is different. Obviously how you just counseling within this niche is
Yeah.
different. But what makes it more effective than maybe traditional counseling, and how is this really correcting course for people that you're seeing?
Yeah. So I think for the most part, traditional counseling doesn't really know what to do with a GI patient,
Yeah.
right? And they can help because there's a lot of overlap, meaning a lot of these GI patients, they either have trauma or they have an anxiety disorder. So if they go to traditional counseling, a
Mhm.
traditional counselor or a therapist is going to help them with their anxiety or with their trauma, but very few of them know how to directly address the GI problems. And actually, like last count, there's 500 gut brain therapists in the world. That's it.
That's it?
Yeah. And there's these amazing treatments, Rachel. I'm telling you, for IBS, for example,
Yeah.
there's 40 years of research, over 100 studies done, showing that these techniques that we use are incredibly effective, but 500 people in the world know how to apply them. Yeah.
Yeah. That's small.
Yeah.
For such a widespread issue.
Right. 45 million Americans alone have IBS,
Yeah.
just IBS. And then there's a bunch of other disorders. So that's why we're very mission driven. We're like, I don't know, this is a bad way to say it, but I feel like this is such a stupid problem. Meaning we've got amazing research after years and years and years, and then nobody has like done anything to create more providers.
Yeah.
There's still just the very few providers, that there's always been.
Why do you feel like it's so stuck? Like you guys have been obviously in the trenches, making really great connections with, other providers and
Yeah.
getting, your word out there. But why do you feel, I mean, healthcare in general is a little stuck, a
You
little
know,
bit
I
sometimes. So,
I think yeah, I think it's behind the times. I think so previously, how did someone get trained in this?
yeah,
You had to go through your PhD program and then you had to do like a specialized fellowship in GI. And there's only like a certain number of places in the country where you can even do that. And they might have one or two people in each of those programs.
Hmm.
So the capacity to put out trained therapists was minuscule, minuscule. And so what we've done in addition to like, so I'm in charge of all the training for our practice. And so we didn't just decide, okay, I'm going to train these people. We've over the last 5 years, we've also been creating a curriculum so we can take a therapist that has some like health psych background,
Yeah,
and we can in 6 to 9 months we can turn them into fully trained, able to handle the most complex cases, gut
sure.
brain therapist.
That's awesome. That's definitely solving part of the problem is that you need more well-trained people in this specific area. And that's very cool that not only are you, spearheading this initiative and doing so different on the client side of it, but you're really helping, other therapists, whether this is something they sought out to specialize in or not, to get that repertoire and to understand, what is needed to help such a large subset of people that suffer from this, which is
Yeah,
huge.
yeah, yeah. Thank
Absolutely.
you.
Yeah, I would love to ask, because I think every specialty in healthcare often gets hit with, the old wives' tales or, especially with anything health related, especially gut, and anything, people are constantly, writing ChatGPT, Dr. Google, as I like to put it,
Yeah.
just to solve, what can I do? How can I solve? This is how I feel. What now? I feel like there's just so many misconceptions across the board. Is there
Mhm.
anything that you have heard over your tenure of doing this and training folks? Is there something that you're like, man, I get this a lot. I want to say this once and for all. Want to put this situation to bed. This A, B, or C is not true, despite what you have read or heard
Right.
from, the grapevine, so to say.
So I think there's so many, but maybe I'll get greedy and I'll say two different ones.
I love it. Let's be greedy.
Yeah, a little greedy. Um, the first one is I think a lot of these IBS patients, they've been told by their doctors, that they've been told by friends or family or Dr. Google or whatever, is that they are condemned to live these very limited, constrained lives where
Mhm.
they can't eat all these different foods and they can't do these certain things. And I want anyone out there who's listening to this to understand if they've got this issue or they've got friends or family, that is not true. They don't have to live with it. The treatments are there. They're short term. They're like 8 to 12 sessions long, but they've got like an 80% effectiveness rate.
Nice.
So people do not have to spend the rest of their life in food jail, in like stomach jail, like there's freedom out there.
I like
Now,
that.
the other one, here's the greediness. I want to clear up one more. There's two major treatments, very specific protocols for cognitive behavioral therapy, not like kind of bread and butter CBT,
Yeah, yeah,
but
yeah.
very specific. But then the other part of the treatment, I'm going to say a word and you're going to have a reaction. You ready?
Okay, I'm preparing myself. Yes.
Okay, you sure?
I'm sitting. This is good.
Okay, okay. Hypnosis.
Okay. Yeah.
Right. Because here's what happens. I say the word hypnosis, and everybody knows what hypnosis is,
Or they think they do.
except they think they know what hypnosis is.
Yeah.
Yes. And what they think they know is entertainment hypnosis,
Yeah.
right? They know
Pocket
the
watch.
pocket watch, clucking like a chicken, mind control, magic. There's always a movie out somewhere.
Yeah.
Yeah.
One, two, three, you turn into
Yeah. Or we've even seen the shows like high school or at college. There are these like entertainment shows.
yes.
And the problem is that is so different than clinical hypnosis.
Yeah.
Clinical hypnosis has been studied, like I said, hundreds of studies over 40 years, but it fights against this massive tide of misinformation,
Yeah.
right? So I want to clear that up that we've got this amazing tool. It's shown to be effective, but you just can't get caught up in all the entertainment side of it.
Yeah. Yeah, my favorite line is like, there's always like one bad banana that ruins it for the bunch. And like
Mm,
the media over sensationalized Hollywood stuff really ruins it for the rest of the bunch. And it's just,
yeah,
it's not true. There's so, like you said, there's so much research. There's so many different ways, and that's why I love this question is because we've all been told things by whether it's our parents or our friends, and we've heard of this, and then you're like, what? Is that
yeah,
true? And then you never reach out or you never seek because that thought always stays in your mind, right?
right, right. Yeah, and you're immediately like, okay, you don't look further beyond that.
Yeah.
And people, just as a little test, there's a little website called PubMed.
Hmm.
PubMed. If you go to PubMed, you can do a search and it'll give you all the medical research. You can search all the medical research that's been done. It's really cool. Type in hypnosis into PubMed. You're gonna get, and so that search would go beyond just the GI stuff because
Yeah.
hypnosis is probably one of the most studied psychological phenomena that's out there. You type in hypnosis into PubMed, you're going to see thousands of articles that have
Yeah.
been written all about it.
Absolutely.
Yeah,
And kind of in that vein, what do you wish aside from this? Maybe seeking out PubMed or some other things, what do you wish that
yeah,
people knew about seeking help?
yeah.
Where do you think they should start? What can they expect? Would love to know that from your aspect, the people that are sitting here wishing, waiting, been told no. What do you wish we all knew?
And this also prompted me to remember. So I said there were two major things that we treat,
Yeah.
and one are all these disorders, IBS included, right?
Yeah.
The other big category is inflammatory bowel disease. So we're
Yeah.
talking about Crohn's and ulcerative colitis. And
Huge.
these are not brain gut disorders. These are very much physical, they're autoimmune, and
Yeah.
yet there's still a lot that we can do to help these patients. There's good research there too. And we're actually partnering with the Crohn's and Colitis Foundation
That's awesome.
right now, and we're putting out in partnership with them, we're putting out an 8-week group therapy that's going to be available to all their members and also just the general public of all those inflammatory bowel disease patients out there that are looking for help and can't find it.
That's amazing. I mean, there's so many people that I know. Again, the same thing. It can count on one hand off the top of my head right now. So many people that I know that have Crohn's or colitis.
Yeah, yeah.
Just another biggie?
Yeah, and they're not, and how many mental health clinicians specialize and really understand those diseases and what those patients go through and the treatment that they need? Very, very few. And that's why we're offering this group treatment because, we just want to make a difference. We want to help.
That's awesome. Yeah, I mean, the people that I'm thinking of on the top of my head had been through so much over the years. And when
Yeah.
they have flare up, not understanding what's going on, the fear of not
Yeah.
feeling well or this happening again. And then you're finally at peace. And then all of a sudden,
The medical trauma, the anxiety, the depression, the feeling of being alone, all of that stuff.
yeah, especially, it's just when you're not in the medical field, it's hard to understand what is happening to you.
Hmm.
This
Yeah.
5 months ago, I felt normal, and especially someone that doesn't know that they have something coming up
Oh,
the
yeah,
pipe.
that initial phase can be traumatizing.
Yeah. I think
Mhm.
it's not talked about enough. So that's such a great resource and thing to say about just knowing where and when to reach out. So it's great that you're having that piece put together. But in the nature of what we do, obviously there's a ton of providers that watch this, a ton of providers that we work with.
Yeah.
What do you think providers can actually do to better help, redirect patients and folks to people like you? Is there more that they can do to understand, where their patients at and what they can need on this side of things?
Yeah, I think just going back to like a previous point, um, the providers that you're talking about, they're going to see a lot of these patients
Yeah,
because patients with trauma, patients with anxiety, patients who have had at any point had an eating disorder, they're all at much higher risk
sure.
for these GI problems, in addition to patients on the spectrum.
Yeah,
So all four of those groups, they're at higher risk. So if you're looking at a standard mental health clinic, a lot of their patients are going to have these GI disorders. And I think going back to that original point, which is if the therapist just soaks this information in and just retains the idea that their patient doesn't have to live with all these GI problems, that the treatment doesn't just have to be about coping with this disorder that's never going to end. Rather, there are specific tools, there are specific methods to learn to actually reduce and sometimes eliminate those symptoms.
sure.
Um, I think if they know that, and they know the right people to send them to, I think that would be a wonderful thing.
I think so too. Helping people out. What a interesting concept that is, to just go the one step further into the research or to help to give a great referral is maybe all it
Yeah,
takes in turning someone's life around completely. And so I just appreciate everything that you're doing and how you're helping, this wonderful community of people that it's large, but has maybe been
yeah.
neglected for a long time and getting this part of care.
I think underserved and misinformed for a really long time.
Those are two very accurate statements and words.
Yeah.
I couldn't agree more. But in the nature of that, to everyone listening, before we leave off today, would love if you can tell everyone who's listening, where they can, seek out more information from you guys, where they might be able to book an appointment or chat, get more information.
Yeah.
This is the shout out moment. Anything that you would like to share with us, we'd be grateful for.
Yeah. Our website is gipsychology.com, and we offer, free 15-minute consult. We've got
Nice.
a clinically trained person who can answer, if you send a patient or if you yourself have a GI issue, which,
Mhm.
since I've started this, a lot of my friends who are therapists have come in through the clinic and gotten treatment. Um, if you want treatment yourself, there's a 15-minute call. You can ask all the questions you want and figure out if it's right for you, if it's right for the patient.
That's awesome. Thank you so much for all the information that you've given us today. A lot to chew on, I think, both from the patient and provider side, along with knocking down some of those misconceptions, which is, I appreciate the greediness because I think it's something that everyone needed to hear today. So thank you, Ollie. It was awesome to chat with you.
Well, Rachel, thanks for the opportunity. It was a pleasure.
Same here.